So shoulder injuries are so complicated because the joint isn't a ball and socket. It's a ball on a plate. A ball in a socket is like this. So the bone acts as a brace. This bone or this ball on a plate, which is what the shoulder joint is, allows for all the range of motion that we have in our shoulder. So we can go up, we can go back, we can go out to the side if we're not injured. So in terms of treating it, it becomes really difficult or more complex in terms of the treatment. If you're using things like prolotherapy or platelets or even stem cells, you can't just stick the needle into the joint and call it a day. It's not enough. The underlying injury still exists. When I treat a shoulder with either prolotherapy or PRP, and eventually I'll be using stem cells as well, depending on if you need it. There are a lot of areas that need to be treated in order to stabilize the whole shoulder. So the entire structure needs to be treated, not just 1 or 2 or 3 points. The rotator cuff comes up here, and with ultrasound, you can see where it attaches to bone. You can also see where it's injured. You can see where there's injury to the tendon, to the bone, and to some of the ligament structures. You can also tell from the exam if the shoulder moves too much, and that gives you an idea of where the injury pattern is as well. So, for example, if someone is hypermobile or is a throwing athlete, even if they have a rotator cuff injury, we need to treat on the underside and the backside, right here. There are other areas that need to be treated that are important for stabilizing the shoulder. For instance, here. Sometimes up here in this joint, this is called the AC joint. There are some people that have an injury right here, and then other people that have neck stuff that goes along with their shoulder pain. So it really requires a good thorough examination, possibly usually an MRI to see what's inside the shoulder or to rule out neck injuries, and then the ultrasound. And all these injections should be done under ultrasound. My name is DrJenniferStebbing. I'm so glad you looked at this video. I can give you more information if you'd like to come in for an appointment. I can be reached at info@DrStebbing.com. My cell phone number, which you're free to use, is 215-630-5935. And if you'd like to read my website a little bit more, it's DrStebbing.com.